Today we're going to discuss the most important topic. So that is the myocardial infarctions. Here, before going to this topic, we should know so what is heart and what is the function of a heart and what is the different layers of the heart. Heart is so that is a muscular organ. It is having a three different layers. So pericardium, myocardium, and the endocardium. Here, the one most important function of a heart is it pumps blood throughout the body and throughout the life. Okay. Now coming, so that is myocardial infarctions. Here the so that is myo means so it is the middle layer of the heart. It is a muscle. Okay, so cardiac means so that is it is cardiac heart. And the infarction is nothing but so death of a cells and tissue the resulting from lack of so that blood circulation to a so the particular part. Okay, so that is myocardium. It means the myocardial infarction is nothing but the death of a myocardial tissue or a cells the resulting from the reduced blood supply. Okay, so that is we call as myocardial infarctions. Here, coming to the so incidence, okay, so mortality rate of so that is myocardial infarctions. So here the census conducted in so the 2024. Here the in the years of the 2024, so 34,000 people so they lost their life the resulting from so that is myocardial infarctions. Here, what it is here the myocardial infarctions also we call as heart attack. In a simple way, it is called as an MI. So what happens? So the blood supply to the so the part of the heart is so that is suddenly blocked. Okay, so it may lead to so death or damages to the so myocardium. Now come to the so the causes of so that is myocardial infarctions or heart attack. The CAD, the coronary artery disease, is the most common cause for so the patient to develop so that is myocardial infarctions. Here, so some of the diseases also there the okay, so that is the for the persons who are suffering from some kind of diseases they are found to get a so the myocardial infarction, so that is diabetes matters, so hypertension. Okay, so now come to risk factor for developing a so myocardial infarction, so that is family history. So there's lifestyle factors like smoking, alcoholism, and the tobacco chewing, in and physical inactivity. So according to the American Heart Associations, for every individual's heart health, for a healthy purpose of a heart, so that is 150 minutes. Okay, so walking is very important. Okay, so physical inactivity also the risk factors for okay so develop obesity leads to atherosclerosis is also one of the risk factor for so developing it, so that is MI. Now come to the so what happens if the patient is suffering from so that is the myocardial infarctions. The patient will show some of the symptoms for the mnemonic, so that is pain snas. Here the pain is nothing but the patient feels the pressure in the chest. Okay, so E is nothing but so the anxiety related to the okay, so the myocardial infarctions. So and the indigestion like feeling, the nausea and the vomiting. So the severe sweating. Okay, so severe sweating is there. So that is mild dizziness. The patient will feel so the mild dizziness. So here the pain radiates usually so arms, shoulders, and the jaw. It is the most important sign for a so the myocardial infarction is so that is the pain radiates to the arms, shoulders, and the jaw. Here the shortness of breath. Okay, so patient will feel shortness of breath and also the heart palpitations. Okay, so this is regarding to these the different signs and symptoms we are going to see the patient is having a so that the heart attack or MI or the myocardial infarction. Now come to this types of so that it's myocardial infarctions. Here the myocardial infarction is divided into three types. So the STEMI, non-STEMI, and the angina pectoris. Here, so what happens in case of so that is STEMI, so that is ST elevations myocardial infarctions, which is so ST elevations, non-ST elevations myocardial infarctions, and so that is angina pectoris. Here, so for easy understanding, so the type 1, okay, so type 1, type 2, type 3 and type 4. Here, according to the American Heart Associations, the myocardial infarctions is classified into so the four types, the type 1, type 2, and type 3 and type 4. Here, type 1 okay, so myocardial infarctions means it involves STEMI and non-STEMI. ST elevation or without ST elevation, the myocardial infarctions. Here the type 2, okay, type 2, so that is myocardial infarctions. So it is resulting from so that is so ischemia, okay, reduced blood supply to the so that is cardiac muscles. So the type 3, so myocardial infarctions occurs. So if the patient develops symptoms, the patient undergoes myocardial infarctions means the patient collapse before reaching to the hospital. Okay, so this type of the myocardial infarction is, okay, so type 3, so that is myocardial infarction. Now coming to type 4, the myocardial infarctions. The myocardial infarction develops the patients, okay, during the so the certain procedures, okay, so cardiac procedure. Okay, so this is regarding to the classification of diabetes, because the classification of, so that is myocardial the infarctions. Now come to this, so what is the diagnostic evaluations we are going to do? Okay, so identify the, so that is a myocardial infarction. The first is ECG. Okay, so depending upon ECG only we have to rule out, okay, so the myocardial infarction seeing the ST elevations. ST elevations. Here the cardiac enzymes like troponin and the CKMB, so that is creatine kinase, myoglobin, and the cardiac angiography. Okay, so these are the important, so that is 2D echo. Okay, so this is the important diagnostic evaluations we are going to use and diagnose them, so that is myocardial infarctions. Now coming the management of, so the myocardial infarctions. Okay, so immediate management includes, so that is MONA. So that is morphine administration of morphine, so because to relieve the pain, severe chest pain, administration of the oxygens to restore the blood oxygen, and the nitrate as well as aspirin. Okay, so this is the most important immediate response to myocardial infarction. So that is morphine administrations, oxygen administrations, nitrate as well as aspirin, and also for the clot, okay, so that is dissolving, so that is streptokinase therapy, thrombolysis therapy is very important. It is administered, okay, so within 12 hours. Okay, so within 12 hours, it is having as the 15 lakh international unit administered IV slowly or over an hour in a, so that is 100 ml NS. Okay, so this is regarding towards administration of streptokinase within 12 hours after developing a, so the myocardial infarctions. Now coming to the, so the American Heart Associations, they are supplying, so that is the okay, myocardial infarctions kit. Okay, so that kit includes are a loading dose. Okay, so loading dose of the myocardial infarction includes the atorvastatin 80 mg and the aspirin 300 mg and the, so that is clopidogrel. Okay, so 300 mg. Okay, so that is the loading dose of, okay, so the patient develops. Okay, so that's the MI. So administered immediately soon after the developing, so that MI administered, so that is loading dose and sent to the hospital. Okay, sent to the higher center for a special treatment. Okay, so this is regarding to this, so there is immediate management. Yeah, some of the surgical procedures are there, CABG, so that is cardiac, so that is coronary artery bypass grafting and the coronary artery bypass surgery is also there. The depending upon the cause, we are going to okay, so performing the different surgery. Now come to the, so there is the most important, so the Karnataka Ratna, we lost Appu sir, so the resulting from, so that is myocardial infarctions, that is the heart attack only. Okay, so for that, remembering, so the government of India so initiated, so one of the most important program. Okay, so that 15th April, okay, so 2024, so that is Dr. Puneet Rajkumar, so that is Hridaya Jyoti Yojana. So Dr. Puneet Rajkumar Hridaya Jyoti Yojana, or so Dr. Puneet Rajkumar Health Scheme. What is the most important? It is a very good program. It is very good program. So they are having a aim to so prevent, okay, so death resulting from, so the myocardial infarctions. So it is having a, so the spoke and hub. Okay, so it works on a model that is spoke hub model. So it means they are having a the close connectivity with the, so that is super specialty hospitals, so that is cardiac hospitals like a Jaidev hospitals and the district hospitals. The every, okay, so they are providing, so public places, so that is, so emergencies, there is MI kits. They are having the loading dose. The loading dose. Okay, so this is regarding to the, so that is myocardial infarctions. Okay.